Not all leg swelling is dangerous, but some types of swelling should not be ignored. The key is knowing the difference. Hi, my name is Dr. Jarrod. I'm a vascular surgeon here in Cary, North Carolina, and today I want to talk about why legs swell, when is it normal, and when is it a sign of vein circulation issues. So why do legs swell? So we all know swelling is the buildup of fluid in our tissues. And because of gravity, it happens more often in your legs. But gravity alone is not the real issue. So before we get into that, let's talk about anatomy very briefly. So arteries, as we know, bring blood away from your heart. Veins bring blood back to your heart. And in the normal process of circulation, where your blood is delivering oxygen, nutrients to our cells, as the artery delivers that blood to your cell and then the vein drains the blood back to the heart, there's some fluid that gets pushed out of the blood vessels, and that's actually normal. Most of that fluid gets drawn back into the vein, and then the vein, delivers the blood back to your heart. Actually, the veins aren't the only blood vessel or vessel that does that. We also have something called lymphatic channels and lymphatic vessels that drain fluid out of our soft tissues as well. So you can imagine if you have anything wrong with your veins or lymphatic channels, like venous insufficiency, or with lymphatic channels, lymphedema, perhaps you may have heard of that, then that can lead to leg swelling. But as you know, there's a lot of different reasons to have leg swelling. You have issues with your heart, kidneys, liver, things like that. When is leg swelling actually normal? So temporary leg swelling can be normal in certain situations, like after a long car ride, at the end of the day, after travel, during pregnancy, maybe after a salty meal. But it's important to know that normal swelling goes away with rest. Problematic swelling does not. If swelling goes away overnight, that's reassuring. If it keeps coming back, that's a signal. So when is leg swelling a problem? Persistent or worsening leg swelling is often a sign that your veins aren't doing their job. Chronic venous insufficiency happens when the veins just don't drain blood well, and it causes a buildup of fluid, blood in your legs, and fluid in your tissues. It's important also to know that you do not need bulging varicose veins to have a circulation problem. So here are some red flags that you should ignore when it comes to leg swelling. Swelling that worsens throughout the day, tightness or heaviness by the evening, skin darkening or thickening, one leg swelling more than the other, or swelling associated with pain, aching, fatigue. Think of it this way: swelling is your body telling you that something's not right, and it's not something to push through, it's something to be evaluated for. So the good news is that finding the cause is pretty straightforward. It's a painless ultrasound that allows us to directly visualize the flow in your veins, and it's something that takes maybe 30 to 45 minutes. Here's something I want you to remember: guessing is stressful, but clarity is not. So if you're in the Cary area and you're dealing with recurrent leg swelling that just doesn't go away, getting answers early can prevent progression and make treatment much simpler. Leg swelling isn't something you have to just live with. Your legs should feel light and not heavy. All right, that's it. I hope this video helps. Leave comments below, and I hope to see you soon. All right, y'all take care.